Hello everyone and welcome. Today, we're diving into a really fundamental, super high-yield topic in obstetrics, the diagnosis of pregnancy. Getting the signs of pregnancy straight isn't just crucial for the clinic, it's also a favorite for examiners. So let's break it all down.
Okay, let's start with a scenario you're definitely going to encounter. A patient comes in, she's missed her period, and she brings a positive home pregnancy test. Your immediate thought is, well, she's pregnant. But is that enough? Is that 100% definitive proof? The answer, well, it's a bit more nuanced than you might think, and by the end of this session, you'll understand exactly why we differentiate between possibility, probability, and absolute proof.
To make sense of this, we're going to use a simple analogy. Let's call it the diagnostic ladder. We'll start at the bottom rung with presumptive signs, which is basically the patient's story. Then we'll climb up to probable signs. These are the objective clues we find as examiners. And finally, we'll get to the very top, the positive signs, which are the absolute, undeniable proof of pregnancy.
Right, so let's start at the very bottom of our ladder, presumptive signs. These are all the subjective symptoms, the things the patient herself reports. They make us presume or suspect a pregnancy is possible. But here's the catch. They aren't diagnostic, because a lot of other things can cause them. Think of this step as your initial history taking.
So what are these classic presumptive symptoms? Well, amenorrhea, a missed period. That's usually the very first sign someone notices. Then you have morning sickness, that classic nausea and sometimes vomiting. Increased urinary frequency is another one, usually popping up around 8 to 12 weeks as the uterus starts to grow and press on the bladder. And finally, there's quickening. That's the first time the mother actually feels the baby move. And for a first-time mom, that's typically around 18 to 20 weeks.
Breast changes are another huge presumptive sign. This slide shows exactly what a prima gravida, a woman in her first pregnancy, might notice. She might complain of a feeling of fullness, maybe some tenderness or a pricking sensation. And as you can see, the breasts enlarge and the veins just under the skin become way more visible. All very common, but again, non-specific signs.
Okay, let's climb up to the next rung and see how our clinical suspicion builds. We are now at probable signs. This is where we shift gears from the patient's subjective story to the objective clues that we as clinicians can actually find during an examination.
So this is the crucial point here. Probable signs make a pregnancy highly likely, but they still don't give us that 100% certainty. These are the things we're actively looking for during a physical exam that really point towards a pregnancy.
First up is Goodell's sign. This is a significant softening of the cervix that you can feel on a bimanual exam as early as 6 weeks. And there's a fantastic classic comparison to help you remember this. A non-pregnant cervix feels firm, kind of like the tip of your nose, but a pregnant cervix, it feels soft, just like your lips. It's a great little trick to remember.
Next is Chadwick's sign, which you might also hear called Jacqueminier's sign. When you do a speculum exam around the 8th week, you might see this dusky, almost bluish discoloration of the vagina and cervix. It's actually a beautiful illustration of the physiology going on. It's all because of increased blood flow and congestion in the pelvic organs.
And here's another classic, Hagar's sign, which you can typically find between 6 and 10 weeks. Now this one is all about the difference in consistency within the uterus itself. The top part, the fundus, is getting firm and growing with the fetus. The cervix below is also relatively firm. But that little segment in between, the lower uterine segment, becomes extremely soft. So soft, in fact, that during a bimanual exam, your abdominal and vaginal fingers can almost feel like they're touching each other.
And of course, a really key probable sign is simply the progressive enlargement of the uterus itself. Before about 12 weeks, it's a pelvic organ, but after that it grows up into the abdomen, and we can start to palpate and measure the fundal height, just like you see here. As a rule of thumb, by 20 to 24 weeks, the fundus is usually right at the level of the umbilicus.
Okay, now let's finally circle back to our initial question about that home pregnancy test. All of these immunological tests that detect the hormone HCG, that's human chorionic gonadotropin, are all considered probable signs. Now you might be asking, why? They're so accurate. Well, it's because certain rare conditions like a hydatidform mole or even choriocarcinoma can also produce HCG. So while a positive test is a very strong indicator of pregnancy, it's not absolute proof all on its own.
And now we've finally reached the top of the diagnostic ladder. We're at the positive signs. These are the ones that give us that undeniable 100% confirmation. There's no more presuming, no more probability. This is it. This is absolute proof.
The key thing to remember about positive signs is that they can only be caused by the presence of a fetus. There are no other differential diagnoses to consider. Once you find one of these signs, you have definitively, without a doubt, diagnosed a pregnancy.
In modern obstetrics, this is, without a doubt, the most common and the earliest positive sign we rely on, the ultrasound. I mean, being able to actually see the gestational sac, then the fetal pole, and most importantly, to see and measure the fetal heart beating, that's incontrovertible evidence. We can often see a gestational sac as early as 5 weeks.
So let's list them out. Here are the 4 classic positive signs. First, actually feeling distinct fetal parts with your hands through the abdomen, which is usually possible after about 20 weeks. Second, hearing the fetal heart sounds, either with a Doppler as early as 10 weeks or a stethoscope from around 20 weeks. Third, as we just saw, ultrasound evidence. And fourth, a radiological demonstration of the fetal skeleton. Now, that's historically important, but it's very rarely used for diagnosis today because of the radiation risk.
All right, we've climbed the whole ladder. Now let's put it all together in a quick, high-yield recap to really lock these concepts in for your exams.
A timeline is a fantastic way to organize all these signs in your head. So think about it. As early as 6 to 8 weeks, those key probable signs like Hegar's, Goodell's, and Chadwick's start to show up. Then, by 10 weeks, we can get our very first positive sign, hearing those fetal heart sounds on a Doppler. Around 18 weeks, the mom reports that presumptive sign of quickening. And then by 20 weeks, you can often get multiple positive signs at once, hearing the heart with a stethoscope and being able to palpate fetal parts.
Okay, pay close attention because this slide right here tackles the #1 area of confusion for students. Let's make this crystal clear. Presumptive signs are subjective. It's what the patient feels. They just suggest a possibility. Probable signs are objective. It's what the examiner finds. They strongly suggest a probability. And positive signs? That's your absolute proof. The fetus itself is detected, which confirms certainty. You should absolutely memorize this table. So, to wrap up with the absolute most important takeaways, presumptive signs, they just raise suspicion. Probable signs make pregnancy highly likely, and positive signs are your undeniable proof. In today's practice, remember that ultrasound is going to be your earliest and most common method for positive confirmation. And I'll say it one more time, differentiating these 3 categories is an absolutely essential, high-yield concept for your exams.
And that brings us to the end, so I'll leave you with a final thought to mull over. Once you have that positive diagnosis, how does this structured understanding of the signs and their timeline actually guide your next steps in management and counseling for antenatal care? Because that's where this knowledge becomes truly clinical. Thanks so much for joining this explainer.